Hello, we are going to be doing our head to toe assessment. We're going to be focusing on our head and neck. So first, I'm going to start by doing hand hygiene, and I have closed the door for patient privacy. So, hello, what is your name?
Samantha.
Hello, Samantha. I'm going to be your nurse today. My name is Melissa. We're just going to be doing a quick head and neck assessment. So I'm going to start with your head. I'm going to check your skin color, and I see that it's pink. I'm looking at your head, and I see that it is in the same size ratio to your body. Now, I'm looking for, at this point, any abnormal shaking or movements within your face. I'm also looking at if it's symmetrical, and it looks pretty symmetrical. I don't see any drooping. Drooping would be a sign of Bell palsy or stroke, so that looks good. And now I'm just looking at your eyes and your ears. Just making sure they are at the same level, that they're proportionate and symmetrical, so that looks good. Now we're going to be doing your facial expression. So we're going to be testing cranial nerve 7. So Samantha, can you close your eyes tightly and open them for me? Okay, can you smile for me and frown and puff out your cheeks? Okay, great. So cranial nerve 7 is intact. Now I'm going to hand hygiene, and we're gonna put on gloves while I inspect your head. So I'm just gonna put on gloves, and now I'm just gonna look at your head, if that's okay with you.
Yes.
Okay, so I'm just checking for any masses, any indentations, any infestations such as lice. I'm also checking to see if she has any bald areas, which would be an indication of alopecia. So I don't see any of that. Everything looks good. So I'm gonna just take off my gloves, and we're gonna do hand hygiene. And now I'm going to locate your temporal artery. So I'm going to find your temporal artery, which would be about right here. And now I'm going to palpate them, and I'm gonna grade them about a 2+. And now we're going to test cranial nerve 5. So we are going to ask the patient, can you clench your teeth? Okay, and I'm just going to feel for your masseter muscle, which is a nice firm ball. And I'm going to also feel your temporal muscle. Okay, and now I'm going to ask you to open your mouth against resistance. And she could do that with ease. So now we know that cranial nerve 5 is intact. Okay, so now we are going to, so we just checked your temporal muscle, and we opened our mouth against resistance. Now I'm just going to feel your temporal mandibular joint, and I'm going to ask you to open and close your mouth, and I'm feeling for any grating or any clicking sensations, which I do not. Everything looks good. And now, if it's okay with you, we're going to palpate your sinuses. So I'm going to start with your maxillary. Do you feel any pain?
No.
Okay, now we're going to do your frontal sinus. Do you feel any pain?
No.
Okay, good. So now I'm going to move on to your eyes. At this point, I'm looking at your eyelid, your sclera, your iris, your pupil, and your conjunctiva. So upon first examination, I don't see any swelling. I see that your sclera is white and shiny. It is not yellow. I see that, I'm going to just take a look at your conjunctiva really quick. If you can take that off for me. Now I'm just going to look at your conjunctiva, which it is pink. Okay, so your conjunctiva is pink. I don't see any redness. I don't see any drainage. And now I'm going to move on with your eyes. So we're just going to do a quick cover test. So I'm going to just occlude one eye. You can open the other one. And I'm just checking for any involuntary movements. I'm doing that to both sides. You can look straight ahead for me. Okay, that looks good. So I'm also looking at how they set on her eye socket. They look equal. I do not see any strabismus, which is any cross-eyed or any involuntary movements. I don't see any anisocoria, which is when one pupil appears a bit smaller than the other. So now we're going to be testing cranial nerves 3, 4, and 6. So first off, I'm going to check for, again, any involuntary shaking of the eye, known as nystagmus. So I'm going to take my pen light and I'm going to just hold it in front of your nose. And I'm going to ask you to just follow the movements of the pen light. So we're going to do the 6 cardinal fields of gaze. So just follow that for me. Good. Great. And our last one. Okay, so that looks good. Now I'm going to look for equal constriction of the pupils. So I'm going to ask you to just look at that object on the wall for me, just to help them dilate, and I'm going to shine my light in one pupil at a time. And I'm looking to see if the pupils constrict equally, which they do. So now we're going to check for accommodation. So again, I'm going to ask you just to look at that picture on the wall for a second, just to help dilate the pupils. And I'm going to take my pen light and I'm going to move my pen light. You can look at my pen light and I'm going to move it in towards your nose. Okay, so I'm looking for constriction, accommodation, and that her eyes cross while it goes inwards to her nose, and it does. So at this point I can document that her pupils are equal, round, reactive to light, and that they accommodate. Okay, so now we're going to be inspecting her ears. So I'm looking at if her ears are symmetrical and the positioning they are in. So that looks pretty good. I'm looking now for any abnormalities, any redness, any drainage. Have you been experiencing any irregular drainage or anything like that?
No.
Okay. And I'm also, as I'm looking at her ears, I'm trying to inspect for tophi, which are found in patients with long-term gout. Tophi are large masses of urate crystals that present as white or yellowish nodules. So I'm inspecting and I don't see any of that. And I'm going to palpate the ears and I'm checking again for any pain or tenderness. Do you feel any pain or tenderness?
No.
How about here in your mastoid process? Okay, so there's no swelling, no redness, no tenderness. I also forgot to mention that I palpated her tragus, so that doesn't have any pain or tenderness, does it?
No.
Okay, so now we will test cranial nerve 8, her vestibulocochlear nerve. So I'm going to ask you to occlude one ear, just cover one ear, and I'm going to whisper about 5 feet away. Just tell me what you hear. Pumpkin.
Pumpkin.
Okay, now can you do the same with your other ear?
Halloween.
Okay, good. So that cranial nerve 8 is intact. Now we are going to inspect her nose. So I'm looking at your nose and I'm looking if it's midline in the face. I'm looking if her septum is deviated, which it is not. I'm going to ask her, have you been experiencing any trouble or any drainage?
No.
Okay, and I'm going to check your patency by asking you to occlude one nostril and just breathing in and out. Good. And the other one in and out. So that's good. And I'm just going to check again and I'm going to look for any drainage, redness, or polyps, and everything looks to be clear. So now we're going to test cranial nerve 1, which is her olfactory, her sense of smell. So I'm going to ask you to close your eyes and I'm going to bring out a pleasant smell for you and just let me know what you smell. Okay, just smell that. What do you smell?
Coffee.
Coffee, good. So she was able to identify that this was coffee, so cranial nerve 1 is intact. Great. So now we are going to inspect your mouth. So I'm looking at your mouth and I'm going to check that they're pink, and they are. Pink represents good oxygen levels, so that is great, and they are not chapped, and I don't see any sores. Now we're going to be testing cranial nerve 12, your hypoglossal nerve. So can you just stick out your tongue and move it side to side? Okay, so that's done with ease, and I don't notice any tremors, so that nerve is intact. And now I'm going to be putting on my gloves. And I performed hand hygiene before I put on the gloves. Okay, and so now we are going to inspect the inside of your mouth using a tongue blade. So I'm going to check the mouth. I'm going to look at the inside of her cheeks, And can you open up for me? Okay. Okay. So the inside of her cheeks look pink. I don't see any sores. I don't see any lesions. Now I'm going to check the tongue. It's pink. It's not beefy red. It's not dried or cracked. It looks moist. And can you lift up your tongue for me? I don't see any lesions or anything like that. That is where mouth cancer usually is found, and everything appears to be normal. And now I'm also going to, while I'm here, inspect your gums. Can you keep your mouth open for me? So everything looks good. I don't see any dental caries, any tonsil exudate. Her tonsils look about +1, normal. I don't see them obstructing her airway or anything like that. I'm also going to look at your soft and hard palate, which appears pink. I don't see any abnormalities or anything like that. That looks good. I'm also looking at, I'm going to ask you to open up. I'm identifying her Stenson's and Warden's ducts, and I see that they're there. They're not, no abnormalities there. And now I'm going to inspect her uvula. Can you say ah? Okay. So I tested cranial 9 by asking her to say ah, and her uvula did. It is in midline, and it does move up as she says ah. And I'm going to try and elicit a gag reflex, so can you just open up for me and just gag really quick? Okay, so that's intact. Cranial nerve 9 is intact. Okay, you alright?
Yeah.
Good. So now we're going to also check off cranial nerve 10, her vagus nerve, because she's able to talk without hoarseness and she can swallow with ease. So just gonna take off my gloves and again perform hand hygiene. Okay, so now we're going to inspect her neck. So I'm gonna ask you to just extend your neck up a bit. Okay, and now I'm gonna just look at your trachea. I'm gonna see if it's midline. And I'm checking for any lesions, any lumps. At this point, if she did have any lumps, for example, a goiter, that could be found in patients who have thyroid problems. So everything looks good. And now I'm going to test cranial nerve 11, her accessory nerve. So I'm going to ask Samantha, can you just move your head side to side and up and down? Okay, and I'm going to ask you, can you shrug your shoulders against my resistance? And she did that with ease, so this cranial nerve 11 is intact. And now I'm going to just palpate the trachea, and it should be midline. I do not feel any, I'm going to ask you, do you feel any tenderness?
No.
Any pain?
No.
I do not feel any lumps, so that looks good. And now we are going to palpate your lymph nodes. So I'm going to inspect for any hard lumps or any inflammation. So I'm going to start with your pre-auricular, which is right here by the front of your ears, your post-auricular, your occipital, your jugulo-digastric, your submandibular, your submental, your superficial cervical. I'm going to go down to your deep cervical chain, your posterior cervical, and your supraclavicular. So none of those are palpable, so that looks good. And you don't experience any discomfort or any pain or anything like that. Okay, that's perfect. So I'm going to just perform hand hygiene again. Everything looks good. Do you have any questions for me?
Nope.
Okay, thank you so much for your time, and I would go ahead and document my findings, which appeared to be normal.